Doctor, what do you think what does the treatment for COPD usually look like?
COPD, the name stands for chronic obstructive pulmonary disease. So, as the first word says chronic, chronic means something that is long term, something that is going to be with you for a long time. When you have COPD, your lung loses a very important function that we don't really appreciate when we are healthy. What is that? So, when we take a breath, it is an active process. You are actively working to take a breath. When you let go, you are just relaxing. You are not pushing air out, right? When you have COPD, your lung loses that elasticity where you just let go of the breath and the air comes out. When you let go, your lungs elasticity makes your lung collapse. But when you have COPD, that does not happen, which means your lung, instead of coming down till here, it only comes till here. The remaining you have to push actively. And that is the biggest limitation in COPD. The obstruction part comes from that. At the microscopic level, you have alveolar destruction, which means air that you get in does not get into the blood and you do not exchange oxygen into the blood very easily. The medications that we have focus mostly on getting rid of inflammation, getting your lungs to open up a little bit so that the air comes out more easier and that you can breathe a little better. So we have two different kinds of inhalants. One is a short acting beta agonist, is as we like to call it, and the name is albuterol. In India it is also called salbutamol. It works for 1 to 4 hours. It opens up your airways. You can breathe a little lighter. There are longer acting inhalers as well, and those tend to work round the clock to open up your airways a little bit more. We also use a medication called corticosteroid inhalations, which help reduce the inflammation inside your lungs so that you don't produce mucus, you don't have that degree of obstruction, and you're breathing a little better. And sometimes patients with COPD also may benefit from oxygen. And when it is really, really, really severe, we tend to consider transplant in certain group of patients who are transplant candidates. But above all this, the most important thing is to exercise, get your strength and stamina better. Because if you go back to the analogy I used about a disease as a burden, COPD is a burden that you're carrying with you all the time. If you improve your strength so much and your stamina so much, you might improve your quality of life as well. Because for somebody to breathe and be active, they need good heart function, good lung function, stamina, strength, balance, and rhythm. These five things, if they are correlating and they're adequate, that is when you're able to do things. So getting out of breath is not completely from your COPD. It can also be compensated for with the other four things if you get stronger. Does it make sense?
Yes, thank you so much, Doctor.